Okay, we had the opportunity to see a very adorable 3-year-old who was presented with hypercholesterolemia, a severe elevation of total and LDL cholesterol. Came to us by way of our gastroenterologist who had seen him because he was having problems with an enlarged liver. And it turns out that he actually had abnormal liver function test. So this very high cholesterol was puzzling to us because we thought perhaps it was a more common variety such as FH, familial hypercholesterolemia. But it turns out that his liver disease actually was the primary event. It's a very rare condition called primary sclerosing cholangitis, or PSC. Our contribution to this is helping physicians understand a very rare disorder. So this condition only occurs in about 1 or less than 1 in about 100,000 people, and primarily been described in adults. The etiology of PSC is unknown, but it seems to have an autoimmune component because in addition to the liver disease, they also have bowel disease or ulcerative colitis. However, our interest really focused on the hypercholesterolemia because when you see levels that are over 1,000, you start thinking about familial hypercholesterolemia and its consequences, which is premature cardiovascular disease. So 50% of men and 30% of women usually have some sort of heart attack or cardiovascular event by the age of 50 with that disease. So obviously our concern. But it turns out that in PSC, the type of cholesterol that's present in the bloodstream is called lipoprotein X. That particular form of cholesterol, lipoprotein X, is actually bound to albumin, not the more common ApoB. ApoB is actually the atherogenic form. So it turns out that if you look at what limited studies are available, lipoprotein X may in fact be cardioprotective. At worst case, it's not harmful. So what we can contribute is being able to remind physicians about this particular entity and the pathophysiology, but also try to avoid having to use medications in this child to lower cholesterol because it's not necessary. Furthermore, there's always cost associated with use of medications and side effects, and so we don't want this child to incur any particular problems. The course of PSC is usually progressive liver disease, and as a consequence, most if not all of these folks usually have to wind up getting a liver transplant. So this young man now is on the transplant list, and we hope that he does well. He's a great kid.